A hiatal hernia is a very common condition that we don't spend a lot of time talking about, but actually impacts a lot of people. It's a hernia in the diaphragm muscle, which is the muscle that separates the chest and abdominal cavities. And when the hernia is large enough, it can actually allow the stomach to slide from the abdominal cavity into the chest cavity, creating a variety of symptoms. Common symptoms of a hiatal hernia include heartburn, acid reflux, indigestion, and for some people, they have a difficult time having food pass through their esophagus. It gets stuck. The dangers of having a hiatal hernia fall across a very broad spectrum. On the minor end of the spectrum, you suffer from acid reflux, discomfort, indigestion after you eat. On the more major end of the spectrum, if the stomach is allowed to slide into the chest, and if it gets stuck there, you can actually have a compromise to the blood flow of the stomach, and that can result in emergency surgery. Hiatal hernias are caused in the same way that any other hernias are caused. So increased intra-abdominal pressure creates a slow and steady pressure over time on the muscle of the diaphragm, causing it to open slowly. It's very similar to hernias that people have in their groin or at their belly button. It's just this one is on the inside of the body. You can't see it on the outside. Obesity is definitely a risk factor as well for hiatal hernias. People often wonder, how do you know if you have a hiatal hernia? And it's an investigation that's prompted by your primary care provider. Typically, you come in with symptoms of acid reflux, coughing, dysphagia, where food gets stuck in your throat, and they initiate some diagnostic imaging. We'll usually start with some x-rays. Most patients will get an upper endoscopy test as well, and we're able to clearly see the hiatal hernia in that way, and also to get an idea of how large it is. Larger hiatal hernias are very amenable to surgical repair, just like any other hernia. A lot of patients don't know that, and so it's something that I've been spending more time talking about because I know that there are a lot of people suffering from hiatal hernias that haven't received the treatment that they would benefit from. Hiatal hernias are treated one of two ways. Number one, if it's mild and not causing you too much trouble, it could be treated symptomatically with antacid medications. For patients who have persistent symptoms, then surgery becomes a very good option for them. It's a laparoscopic operation. You stay one night in the hospital after it's done, and we're able to repair the hernia and prevent any future acid reflux. Laparoscopic surgery is a minimally invasive surgery technique where I place little tiny, we call them keyhole incisions, that are anywhere from 5 to 11 millimeters in diameter, and we have special tools and instruments that we're able to put through those small incisions. With those tiny little incisions, the recovery is very fast. Pain is very minimal compared to the bigger open operations that we used to do.